this is Jo Kalea from Pregnancy and Me, and I'm with Shraddha Patel from Amethyst Physio, and we're both talking to Ruth Jamison from The Modern Diabetic on our diabetes series in pregnancy, and today we're focusing on type 2. So hello, Ruth and Shraddha. Welcome to today's series.
Hello.
Hey. And I guess the first question we have here is could you explain what type 2 diabetes is?
Okay, so last week we were talking about type 1 and how it was an autoimmune disease, and type 2 diabetes is a metabolic disease.
Right.
And it's quite interesting, that they both call diabetes because they are two very, very different diseases. One is an issue with the immune system and the other one is a metabolic disease, but they call diabetes because the end result is high blood sugar, even though the mechanisms for why that blood sugar is high is different. And of all of the diabetes in the world, about 90% is type 2 diabetes.
Wow.
It's the most common form of diabetes. And in type 2 diabetes, the person's cells become resistant to the insulin. So as we said in last week, where the body destroys the beta cells that make the insulin, and so they don't have enough. In type 2 diabetes, they have plenty, they have too much, but the cells are no longer taking in the glucose that the insulin is bringing to them. And so the body keeps producing more and more insulin, but the glucose doesn't get into the cells, and the glucose is very elevated because the cells have reached their capacity for taking in any more energy.
Oh.
And the thing with type 2, it's one of the biggest killers out there. But it's the most preventable.
Right. And that's true.
So preventable, through diet modification, through being more active, and through various other things. There's quite a few risk factors, but it's completely preventable, and if caught early on, completely reversible.
Wow. Well, that's encouraging, isn't it?
Yeah.
But what if you're pregnant? What if you're pregnant and you get type 2, or you've got type 2?
Well, ideally, you want to make the changes before you get pregnant.
Right.
So if you are thinking to get pregnant, spend 6 months to a year trying to reverse that insulin resistance and sort of get yourself into a healthier state. If you are already pregnant, there is still a lot you can do. You need to kind of really change your diet. You need to kind of lower your carbs. You need to be more active and all that kind of thing, because the biggest risks around it is that your offspring have an increased chance of getting type 2.
Oh, right. Okay.
Because what happens, it's the same as in type 1, where there's an increased risk for that child to get type 2 as well if the blood sugar is not under control. Because when that blood sugar is really high, that baby's pancreas then produces a lot of insulin to deal with all that extra glucose. But when your baby is in your womb, the way that baby's body is being built and being set up is taking signals from its environment about how best for it to form to survive and thrive. And so it just ends up being set up because it's already producing a lot of insulin, because it thinks, well, it's like an environment where there's an abundance of glucose. That baby is at risk of being really big for its birth weight. So, they're always wanting to monitor and make sure that the baby's not getting too big, which is why they often want to induce like 2 weeks early, or why they might in some countries encourage cesarean because the baby gets too big.
Right.
So yeah, and it's anybody who has a family history of type 2 or is overweight, or certain ethnicity, like, you know, they're at a very, very increased risk of having type 2, and they should really sort of, you know, get themselves tested with their doctor to see whether they're developing type 2 and start making those changes pre-pregnancy. But people who end up getting gestational diabetes, that's a red flag, you know, that's like, okay, something's already sort of happening there, and that's their red flag. Like, you know, it does go away for most people, but a lot of those women go on to get type 2 if they haven't sort of taken that as their, like, wow, I need to do something, I need to change my diet, my lifestyle to prevent it.
Right. So how will it affect the mother in pregnancy?
I guess it's more, I think, more about the risk of the baby. I guess in pregnancy, like the mother might need more medications and stricter diets and everything, you know, to try and really control that. They're less likely, if they want a completely natural birth, to have that completely natural birth. Is more likely to kind of be more interventions and things. If they already had type 2 pre-pregnancy, their blood sugar will be even harder to control because of that extra insulin resistance that comes with pregnancy.
Right.
Yeah.
Okay.
But it's more about sort of, you know, I guess, less complications with the birth and the health of the baby.
Right. Okay. And can you pass on? Did you say that you can pass on type 2 to the baby?
Yeah, so you can, I guess, you know, it's not to kind of see type 2 diabetes as this infectious disease that you pass on. You know, you're not born with type 2 diabetes. No child is born with it, but you kind of set them up in a way to be more at risk of developing it later on in life. Or, you know, even worse, like if especially if you don't change your diet, you continue to sort of eat processed foods, lots of sugars, lots of unhealthy fats, you have a sedentary lifestyle, your child learns from you, and they've already got the risk genes, or the body's already been set up to be like that, and then it's put in an environment that then puts them even more at risk of developing type 2.
It totally makes sense, Ruth. Yes, because in uterus there's already an environment, and then outside, if there is no healthy dietary changes, that's it. I've seen the people where, you know, having Coke with food is norm, having everyday dessert is norm. So
yeah. And I'll just say something here. It was quite interesting. My boyfriend, he's not diabetic. He did 100-kilometer bike ride a couple of days ago, and as he was maybe like 10 kilometers away from home, he kind of, you know, hit the wall, as they say, where he just ran out of energy. He couldn't think straight, and he sent his riding partner to the shop. He eats relatively low carb. He just thought, stuff it. He bought a Coke, he downed a can of Coke, he ate a whole lot of Skittles or whatever. It gave him energy to get home. I tested his blood sugar an hour after he did that, and it was 7.6, which is high. So it shows that the food, food, like these people, and there's a lot of people in my diabetes groups that for fun, they're putting like a sensor on their partner who's not diabetic and just seeing what their blood sugar does. And when they're eating all of these junk foods, their blood sugar goes really high. And so for the people that are constantly doing that and have, you know, all the other things like the risk genes and the other, you know, I think there's like, I wrote it down, there's like 12 risk factors for type 2 diabetes, which we can go into. All of that stacks up, and that person's then, it's such a high risk of getting, you know, type 2. And if one parent has type 2, their child has 40% risk, and if both parents have type 2, their child has a 70% risk of developing it. That's really high.
Yeah. So that's one of the questions I was actually going to ask. Yeah,
preventable, you know?
Preventable. Yeah. So it's genetics as well that can be prevented if you follow a good lifestyle.
Yeah, there's just certain ethnicities like, Latino, Native Americans, Inuits, Native Hawaiian, other Pacific Islanders and Asians and African Americans seem to be at higher risk and at higher risk of severe complications. And, it's not that they were born with a faulty body, it's that they are eating foods that were not designed for their body. The food that we have now, the biggest thing is, right, think about it. Can you think of any food in nature that combines lots of carbs and lots of fats in one food?
Not at all. I cannot.
We make it, right?
That's right.
We make it, the breads, the chips, the donuts, whatever. And you know what?
Yeah.
These foods are devoid of nutrients. They are irresistible, and they don't fill you up.
No, that's right. That's exactly right.
So true. Yep.
So we can
It's like our go-to when we're snacking.
Yeah, and snacking, right? Like the whole snacking thing. 100 years ago, we ate on average 1,000 calories less than we eat today because we didn't snack.
Yeah.
Men were out in the field plowing the farm. Women were in the house doing housework non-stop. So we were far more active and we ate less and we didn't eat constantly.
Yeah.
This whole thing where we're told eat every 2 hours, you need to snack. Rubbish. The food industry made it up because they want to make money out of us, not because we need it.
That's exactly right. Yes, I found out the hard way.
And the other scary thing is that they say 50% of people don't realize that they have type 2 or are insulin resistant. They're walking around and they have no idea. It's very, very underdiagnosed. And, if you as a female, if your waist is more than 35 inches and a male more than 37 inches, if you're carrying that weight around the middle, you're at an increased risk for sure. And there's other things, environmental toxicity. Our bodies, in order to protect its vital organs, stores toxins in fat because it's safe. And so it's going to hold on to that fat.
Yeah, that's right.
Right? Because if it lets it go, it damages the body. So people that are struggling to lose weight and they change their diet, you might want to kind of go, well, like, how toxic are you? How toxic is in your environment? Maybe if we clean that up, the body might let go of some of that. Dysbiosis, which is an imbalance in gut bacteria.
Right.
Our gut bacteria are responsible for a lot of our health. We made up more of bacteria than human cells. They help us metabolize and absorb some of our nutrients. They help, people who are overweight have more of a certain bacteria compared to people who have a good weight, and our bacteria gets damaged by giving antibiotics too frequently when it's not needed, from all the pesticides in the food and all of that. There's so much unnatural that's kind of unbalancing that. So that's a risk factor.
Even the chemicals in your household, I'd say as well. That's another. That you don't realise that's silently around you, that people just aren't aware. The harmful effects.
Overeating, inactivity and exercising, it's not just about exercise. You cannot sit for hours, like 8 hours a day at your desk, sit in front of the telly at night and then go to the gym for an hour every day and think that you're doing all that sitting. We weren't designed to be so sedentary. And that's another really big factor. It's like people kind of go, oh, but I exercise. And what a lot of people do is they overtrain. They go to the gym and they hit it really, really hard. And if they're already kind of overworked and stressed and exhausted and maybe overweight and their body's stressed anyway, that's overtraining.
And I want to add, and Ruth, this reminds me of this thing that, I don't know, I hear this constantly that our brain needs glucose so that after a burst of exercises, you just run to the bar of chocolate or something sugary because you think, oh, our brain needs glucose. Is that true? Do we have to have glucose in our brain? Even my diabetic friends keep the sugar for because they say,
yeah, let me explain it. The thing is, right, so we can run on glucose, but we can run on fats. Most of us, because of the food we're used to eating, our body only runs on glucose. It's a very fast fuel. It's very easy for the body to make, so it's very fast. And if we've been running on that fuel for a long time, our body has kind of forgotten to run on fat, and it can't. You're not metabolically flexible, right? So what happens as well is that people are, if they're eating unhealthily and their blood sugar is like up and down and up and down and up and down, they are going to have this point where they exercise or whatever, their blood sugar really drops, and it's a survival thing. The body knows, I've got no other fuel, I need glucose, it's the quickest thing to bring me up, and your body and your mind knows sugar.
Oh my God.
You know, it knows to go for that.
Yeah, and that really tells what you're telling about exercise. It should be graded. It should be in a good proportion. It should be just as food. It should be part throughout the day, not just like one big.
Yeah, you should just, you know, because a lot of this, a lot of it's actually quite damaging. You know, when we push our bodies really hard, we are damaging our body.
Makes sense.
You know, it's not to say that like it's important. I think, especially the older we get, to do some weight-bearing kind of exercise for our bone health and that. But you see many kind of cultures and societies where they don't do any mad exercise, but they're super healthy because they're just active. And yeah, they are carrying things and their bodies are fit and strong because they've always kept it like that. But you can push it too far. That's why so many top athletes, their career is done by the time they're 35 because they've damaged their body.
Yeah,
you know, you know, if you are exercising, you can fuel yourself with healthier things other than loads of sugar and blah 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 and all these kind of things. You just eat healthy food. You can get that fuel you need from what nature provides us. We've been doing it for millions of years. That's why we're here today.
Yeah, that's right. Exactly. No, it's good to know. So, what about if we just do a summary of what we've learned throughout these series? What would be the most important points we could summarize for everyone on gestational type 1 and type 2? I guess they're very similar.
They similar and different, but I think, you know, the advice or the summary around all of them are that, you know, there is so much you can do to manage your diabetes with a healthier diet, with going low carb, like depending on the severity of your diabetes and all of that. And there is a lot you can do to prevent gestational and type 2, you know, with diets, completely preventable. Type 1, less so, but there is, you know, like we spoke about before, there's all these environmental things that we haven't quite worked out what triggers the immune system to do this. But it is still environmentally induced. It's, you know, there's genetic components for sure, but you weren't born with the disease. Something has happened in your life that has triggered it. But yeah, the underlying message is, you know, eating a healthy, nutrient-dense whole food, like get rid of all the processed stuff, cut out the extra sugar, cut out the unhealthy fats, be active, you know, trying to be organic, and also just with your household products and everything like that, choose stuff that's got less chemicals in. Just there is we're overburdened with so many toxins, and you know, the biggest thing is that they'll say, oh, this toxin is not shown to be detrimental to human health, but what they're not looking at is it's a cocktail of toxins. That's what's detrimental, you know. And Yeah, and looking after your gut health, you know,
Yeah.
eat lots of fermented food to make
Yeah.
sure that you're getting all the good bacteria in there, not taking antibiotics for a sniffle, you know, like
Yeah.
antibiotics have their place. They can save your life when it's a life-threatening infection, but it's not something you need for every little thing that's going on.
Yeah.
Yeah, I mean, that's the overlying thing. It doesn't really matter what kind of diabetes you have. You can have better outcomes in pregnancy, have healthy pregnancy, have a healthy baby, if you work on diet and lifestyle intervention.
And prevention is better than cure.
Always,
Which is the main one.
Yes.
So thank you. It's been another interesting night. Do you have any other questions, Shraddha? Are you okay? Is there anything else you'd like to ask?
No, I think I'm all good. I'm sure I have a few, but we can put it on next time, actually.
Yeah, well, I like
I want a lot of people to hear this, and that's why we're keeping it short, because it's very educational, very much needed.
Yeah. So let us know what you think. Share this around. Comment. Write to us if you have any other questions. Thanks, everyone, for joining us. This is Jo Kalea from Pregnancy and Me with Shraddha Patel from Amethyst Physio, talking once again with Ruth Jamison from the Modern Diabetic. Thanks, everyone.
Bye-bye.
Bye.